Hey everyone, my Sunday Quinn asked me to post this video of his finger. Anyway, he got his blister open today. He's perfectly fine. We follow up Monday with the wound care doctor. He did have 2 stays in the hospital. His dad quickly got him to the ER as soon as he got bit. Yes, he picked up a snake he shouldn't have. He didn't know it was a rattlesnake.
Welcome to our video, the terrifying pygmy rattlesnake bite wound. In this series, we'll explore the dangers posed by pygmy rattlesnakes and how to navigate the aftermath of a bite. Let's start with an introduction to these fascinating yet perilous creatures.
Pygmy rattlesnakes, scientifically known as Cistrurus malarius, are venomous snakes native to the southeastern United States. They typically inhabit wooded areas, marshes, and grasslands.
These snakes are relatively small, typically growing between 15 to 24 inches in length. Their small size and intricate patterns allow them to blend seamlessly into their surroundings, making them difficult to spot.
Despite their diminutive stature, pygmy rattlesnakes possess potent venom, primarily composed of hemotoxins. When injected into their prey or a potential threat, this venom can cause severe tissue damage and disruption of blood clotting. Their venom can have devastating effects on humans, causing symptoms such as swelling, pain, bruising, and in severe cases, organ failure or even death. In terms of behavior, pygmy rattlesnakes are ambush predators, lying in wait for unsuspecting prey to pass by. They have a characteristic rattle on their tail, which they use as a warning signal when feeling threatened.
Even though quite inaudible, this rattle serves as a crucial warning sign for potential danger, allowing humans and other animals to steer clear of these venomous snakes. Now that we've learnt about the habitat, behavior, and characteristics of pygmy rattlesnakes, let's delve deeper into the composition of their venom and the terrifying effects it can have on the human body.
The venom of the pygmy rattlesnake is a complex cocktail of proteins and enzymes, primarily hemotoxins. These toxins target the blood and tissues of their prey, causing extensive damage. When injected into a human victim, the venom quickly spreads through the bloodstream, disrupting normal clotting mechanisms and causing hemorrhage and tissue necrosis.
Victims of pygmy rattlesnake bites may experience immediate symptoms such as intense pain, swelling, and discoloration at the site of the bite. As the venom progresses, systemic effects such as nausea, vomiting, dizziness, and difficulty breathing may manifest. The severity of symptoms depends on various factors, including the location and depth of the bite, the amount of venom injected, and the victim's individual health and immune response.
In severe cases, pygmy rattlesnake envenomation can lead to life-threatening complications such as organ failure, shock, and even death if left untreated. As we've seen, the venom of the pygmy rattlesnake is a potent weapon capable of inflicting serious harm. In the next segment, we'll explore the crucial steps to take in the immediate aftermath of a bite and the medical interventions available to mitigate its devastating effects.
After a pygmy rattlesnake bite, victims are thrust into a harrowing ordeal as they grapple with a cascade of debilitating symptoms. Let's explore the distressing manifestations of envenomation. Following a pygmy rattlesnake bite, victims may experience a range of symptoms, starting with localized effects at the site of the bite. These include severe pain, swelling, redness, and bruising.
The venom swiftly infiltrates surrounding tissues, triggering an inflammatory response that exacerbates pain and swelling. Victims may also notice the formation of blisters and discoloration as the venom takes its toll. As the venom spreads through the bloodstream, systemic symptoms may emerge, signaling a dire escalation of the envenomation. These can include nausea, vomiting, diarrhea, dizziness, weakness, and profuse sweating.
The onset and severity of symptoms vary from person to person and depend on factors such as the amount of venom injected, the victim's health status, and the promptness of medical intervention. Prompt recognition of bite symptoms is crucial for initiating timely treatment and preventing further complications. Anyone bitten by a pygmy rattlesnake should seek medical attention immediately, as delayed treatment can worsen outcomes.
As we've seen, the symptoms of a pygmy rattlesnake bite can be distressing and debilitating. In the next segment, we'll explore the essential steps to take in the immediate aftermath of a bite and the medical interventions available to mitigate its devastating effects.
The first priority after a pygmy rattlesnake bite is to remain calm and quickly assess the situation. Move the victim away from the snake to prevent further bites, but avoid exertion to minimize venom spread.
Next, remove any constrictive clothing or jewelry near the bite site, as swelling can occur rapidly. Keep the affected limb immobilized at or slightly below heart level to reduce blood flow and venom spread.
Do not attempt to suck out venom or apply a tourniquet, as these methods can worsen tissue damage and complicate medical treatment. Instead, wash the bite area with soap and water to reduce the risk of infection.
Apply a clean, sterile bandage to the bite wound, covering it loosely to allow for swelling. Mark the time of the bite and monitor the victim's vital signs while awaiting medical assistance.
If possible, transport the victim to a medical facility as soon as possible, keeping them calm and reassured along the way. Remember, time is of the essence in treating pygmy rattlesnake envenomation.
By following these first aid procedures, you can provide crucial support to a pygmy rattlesnake bite victim in their time of need. In the next segment, we'll explore the medical treatments available to address the effects of envenomation and facilitate recovery.
Upon arrival at a medical facility, pygmy rattlesnake bite victims will undergo a thorough assessment to evaluate the extent of envenomation and determine the appropriate course of treatment.
Treatment may involve the administration of antivenom, a specialized medication derived from horse serum or other sources. Antivenom works by binding to and neutralizing the venom toxins, halting their destructive effects on the body.
In addition to antivenom therapy, victims may receive supportive care to manage symptoms and prevent complications. This may include pain management, intravenous fluids to maintain hydration, and monitoring for signs of systemic effects such as bleeding or organ dysfunction. In severe cases of envenomation, patients may require intensive care and close monitoring to ensure optimal outcomes. This may involve respiratory support, blood transfusions, and other interventions to stabilize vital functions.
Early intervention is key to maximizing the chances of recovery from pygmy rattlesnake envenomation. Prompt medical treatment can significantly reduce the risk of long-term complications and facilitate a smoother recovery process.
As we've seen, medical treatment plays a crucial role in addressing the effects of pygmy rattlesnake bites and promoting healing. In the next segment, we'll explore the recovery journey for individuals bitten by pygmy rattlesnakes and the steps involved in regaining health and well-being.
Recovery from a pygmy rattlesnake bite is a multifaceted process that encompasses physical, emotional, and psychological aspects. The duration and trajectory of recovery can vary depending on factors such as the severity of envenomation and the effectiveness of medical treatment.
Physical rehabilitation plays a crucial role in the recovery process, particularly for individuals who have experienced tissue damage or loss of function as a result of the snakebite. Physical therapists work closely with patients to improve mobility, strength, and flexibility through targeted exercises and interventions.
In addition to physical rehabilitation, psychological support is essential for addressing the emotional toll of a traumatic snakebite experience. Victims may experience fear, anxiety, and post-traumatic stress symptoms, which can impact their overall well-being and quality of life.
Support groups, counseling services, and educational resources can provide valuable support and guidance to individuals and their families as they navigate the challenges of recovery. Connecting with others who have experienced similar ordeals can foster a sense of camaraderie and empowerment.
As patients progress through the recovery process, regular follow-up appointments with healthcare providers are essential for monitoring progress, addressing any lingering symptoms or complications, and adjusting treatment plans as needed.
While the recovery journey following a pygmy rattlesnake bite may be long and challenging, with perseverance and support, individuals can overcome adversity and reclaim their health and well-being. In the next segment, we'll explore essential tips for preventing encounters with pygmy rattlesnakes and reducing the risk of bites.
First and foremost, awareness is key. Educate yourself and others about the habitats, behaviors, and identifying features of pygmy rattlesnakes. Knowing where they are likely to be found and how to recognize them can help you steer clear of potential encounters.
When exploring natural habitats, stay on designated trails and avoid walking through tall grass, brush, or rocky areas where snakes may be hiding. Use a walking stick or hiking pole to probe ahead and alert snakes of your presence.
Be mindful of your surroundings, especially when reaching into or around rocks, logs, and other potential hiding spots for snakes. Always watch where you step and avoid placing your hands or feet in areas where you cannot see. Wear sturdy hiking boots or closed-toe shoes, long pants, and thick socks to provide a physical barrier against snake bites. Consider using snake gaiters or leggings for additional protection, particularly in high-risk areas.
If you encounter a pygmy rattlesnake or any snake in the wild, give it plenty of space and respect its territory. Do not attempt to handle, provoke, or antagonize the snake, as this can increase the likelihood of a defensive bite.
By following these prevention tips and staying informed, you can minimize the risk of encountering pygmy rattlesnakes and ensure safer outdoor adventures for yourself and others. Remember, awareness and preparedness are our greatest allies in coexisting with nature's wonders.
Hey everyone, my Sunday Quinn asked me to post this video of his finger. Anyway, he got his blister open today. He's perfectly fine. We follow up Monday with the wound care doctor. He did have 2 stays in the hospital. His dad quickly got him to the ER as soon as he got bit. Yes, he picked up a snake he shouldn't have. He didn't know it was a rattlesnake. As far as I'm aware, I had no idea rattlesnakes even were in Oklahoma. Now we know, and now he's learned to always check. Telling him not to pick him up isn't really going to help because he's a country kid. But hopefully he learned. It's going to be a lesson learned. Anyway, they did wrap his finger. We have a silver foam thing on there. It's gauze, some kind of gauze looking thing. It has silver in it to help with his wound. As far as skin grafts or anything, we're unsure. Taking it one day at a time. We gotta clean it one time a day.
Pygmy rattlesnake bites are a sobering reminder of the inherent risks associated with outdoor activities in snake-prone areas. However, by staying informed, exercising caution, and being prepared, we can minimize the likelihood of snakebite incidents and mitigate their impact.
Remember to remain vigilant when exploring natural habitats, wear appropriate protective clothing, and familiarize yourself with snakebite first aid protocols. Additionally, seek prompt medical attention in the event of a snakebite, as timely intervention can greatly improve outcomes.
Thank you to all who have joined us on this educational journey. Your commitment to learning and preparedness is invaluable in promoting safety and well-being in outdoor environments. Together, we can raise awareness, reduce the incidence of snakebite incidents, and ensure a safer future for all.
His rattlesnake bite blister is now leaking.